Have you noticed your clothes fitting looser even though you haven't changed your eating habits or exercise routine? Maybe you've looked in the mirror and seen a thinner face staring back at you, or perhaps a family member has commented that you're looking slimmer. At first, you might feel pleased. After all, losing a few pounds without even trying might seem like a pleasant surprise. But here's the truth: when weight starts dropping without an obvious reason, it's often a serious warning sign that something is wrong inside your body. Many seniors brush off unexpected weight loss, assuming it's just a normal part of aging. They might say, "I must be eating less than I thought," or "maybe it's my metabolism slowing down." But here's the thing: as you age, your metabolism typically slows down, making it harder to lose weight, not easier. If you're shedding pounds without trying, your body could be struggling with an underlying health condition that you shouldn't ignore. One of the biggest red flags associated with sudden weight loss is cancer. Cancer cells grow rapidly and require a huge amount of energy, essentially stealing nutrients from your body. This can lead to drastic weight loss in a short period of time. The most common cancers linked to sudden weight loss include pancreatic cancer, one of the deadliest cancers, often diagnosed in late stages because symptoms remain hidden for so long. Stomach cancer. This can cause appetite loss, making it even harder for your body to maintain its weight. Lung cancer can lead to metabolic changes that result in weight loss even when you're eating normally. Esophageal cancer makes swallowing difficult, leading to a gradual drop in calorie intake. In many cases, these cancers don't present obvious pain or discomfort early on, making weight loss one of the first symptoms to appear. Unfortunately, many people fail to recognize it as a warning sign and wait too long before seeking medical help. By the time they see a doctor, the cancer has progressed to a more dangerous stage, reducing their chances of survival. To put this into perspective, medical experts say that if you lose more than 5% of your body weight within 6 months without making any diet or exercise changes, you need to be concerned. That means if you weigh 160 pounds and suddenly drop to 152 pounds or less without trying, it's time to see a doctor. Even if you feel fine otherwise, this is not normal and should not be ignored. But cancer isn't the only culprit behind unexplained weight loss. Other possible causes include 1. Thyroid disorders. Your thyroid gland controls metabolism, and when it becomes overactive, hyperthyroidism, it can cause your body to burn calories at an accelerated rate, leading to rapid weight loss. 2. Diabetes in older adults. Undiagnosed diabetes can cause weight loss due to the body's inability to process glucose properly. This means you might be eating normally, or even more than usual, but still losing weight. 3. Digestive disorders. Conditions like celiac disease, Crohn's disease, or irritable bowel syndrome, IBS, can make it difficult for your body to absorb nutrients, leading to gradual weight loss over time. 4. Chronic infections. Certain bacterial, viral, and parasitic infections can cause inflammation, damage the digestive system, or disrupt metabolism, leading to unexpected weight loss. 5. Depression and mental health conditions. Seniors often experience changes in appetite due to emotional distress, grief, loneliness, or depression. This can cause them to eat less without realizing it, leading to gradual, unnoticed weight loss. Why this matters more in old age. Unlike younger individuals, older adults are more vulnerable to the effects of weight loss. As you age, losing even a few pounds can have a major impact on your immune system, energy levels, and overall health. Losing muscle mass in old age can increase the risk of falls, fractures, and mobility issues, making everyday tasks more difficult and dangerous. What you can do right now. If you've noticed weight loss without trying, don't dismiss it. Here's what you should do immediately. Monitor your weight weekly. Weigh yourself at the same time each week, under the same conditions, and track any unexpected changes. Pay attention to your eating habits. Are you eating less without realizing it? Do you feel full quickly? If your appetite has changed, it could be a red flag. Schedule a doctor's visit. A healthcare professional can conduct blood tests, imaging scans, and other diagnostic tests to rule out serious conditions. Maintain a nutrient-rich diet. Focus on consuming enough protein, healthy fats, and complex carbohydrates to maintain muscle mass and keep your body strong. Stay active. Even light physical activity, like walking or resistance training, can help preserve muscle mass and prevent frailty. Final warning: don't ignore this sign. The scariest thing about unexplained weight loss is that it often feels harmless at first. Many seniors think, "It's probably just a natural change," or "I'll gain it back soon." But waiting too long could mean missing the early window of detection for a life-threatening illness. If you or someone you know is experiencing unexplained weight loss, take action now. The sooner you identify the cause, the better your chances of early intervention and recovery. Ignoring it could allow an underlying illness to progress until it's too late. Sign number 2: persistent fatigue. The silent warning sign you must not ignore. Do you ever wake up feeling just as tired as when you went to bed? Do simple tasks, like walking to the kitchen, folding laundry, or even having a conversation, leave you feeling completely drained? Maybe you've noticed that by midday, you need to sit down, rest, or even take a nap just to make it through the day. While fatigue is often blamed on aging, poor sleep, or stress, persistent exhaustion could be an early warning sign of cancer, and many seniors fail to recognize it in time. Fatigue is different from normal tiredness. This isn't just the kind of exhaustion that comes after a long day or a poor night's sleep. Cancer-related fatigue feels deeper, more overwhelming, and doesn't go away with rest. No matter how much sleep you get, your body still feels sluggish, weak, and unable to recover its energy levels. It can feel like you're constantly running on an empty battery, and no amount of coffee or rest seems to help. Why does cancer cause fatigue? If cancer is developing in your body, it can interfere with your body's normal functions in several ways. Cancer cells steal your body's energy. Tumors require a huge amount of nutrients to grow. They essentially hijack your body's fuel supply, redirecting energy away from essential bodily functions and leaving you feeling weak and drained. Inflammation wears down your immune system. Many cancers trigger a constant immune response, which forces your body to work overtime. This prolonged fight drains your body, causing deep and lasting fatigue. Anemia develops due to blood loss. Certain types of cancer, especially colon cancer, leukemia, and lymphoma, can cause slow, internal bleeding that you may not notice. Over time, this leads to anemia, a condition in which your body lacks enough red blood cells to carry oxygen, making you feel dizzy, weak, and constantly tired. Disruptions in sleep patterns. Some cancers affect hormone levels, which can throw off your body's natural sleep cycle. Even if you think you're getting enough hours of sleep, the quality of your rest may be poor, leaving you groggy and exhausted during the day. Which types of cancer are most commonly linked to fatigue? Fatigue is a universal symptom in cancer patients, but some types are more likely to cause extreme tiredness early on. These include leukemia and lymphoma. These blood cancers affect the production of healthy red blood cells, leading to constant fatigue and weakness. Lung cancer can make breathing more difficult, reducing oxygen levels in the blood and making you feel exhausted even after light activities. Colon cancer often causes slow internal bleeding, which leads to anemia and severe energy loss. Liver cancer affects the body's ability to process toxins and nutrients, leading to chronic tiredness. The danger is that fatigue is often overlooked as just a normal part of getting older. Many seniors assume that feeling drained is just a sign of aging, poor diet, or not sleeping well. However, if your fatigue is persistent, severe, or getting worse, it's critical to pay attention and take action. How do you know if your fatigue is a warning sign? Not all tiredness means you have cancer, but here are some red flags that suggest your fatigue might be a sign of something more serious. You feel exhausted all the time, even after sleeping well. Your fatigue is worsening over time instead of improving. Everyday tasks, like showering, cooking, or even talking, feel overwhelming. You experience unexplained weight loss along with your fatigue. You have other symptoms like shortness of breath, dizziness, pale skin, or unusual bruising. Your fatigue is accompanied by pain, swelling, or night sweats. If you checked off more than one of these symptoms, it's time to talk to a doctor immediately. What other conditions can cause persistent fatigue? While cancer is a major concern, other medical conditions can also cause chronic fatigue, especially in older adults. Some common culprits include heart disease. A weak heart can make your body work harder to pump blood, leaving you exhausted even after minor exertion. Diabetes. High or low blood sugar levels can cause fluctuations in energy, leading to extreme fatigue. Thyroid disorders. An underactive thyroid, hypothyroidism, slows down metabolism, making you feel sluggish and drained. Depression or anxiety. Mental health conditions can sap your motivation and leave you feeling constantly tired. Vitamin B12 or iron deficiency. If your body isn't getting enough of these essential nutrients, you may feel weak, dizzy, and fatigued. What you should do if you're experiencing chronic fatigue. Ignoring persistent tiredness could mean missing the early warning signs of a serious health condition. If your fatigue has been ongoing for more than a few weeks, don't brush it off. Take these steps right away. Keep a fatigue diary. Write down how often you feel exhausted, what activities make it worse, and whether you experience any other symptoms. This can help doctors pinpoint the cause. Check for hidden bleeding. If you have dark stools, frequent bruising, or unusual paleness, you may be losing blood internally. A simple blood test can check for anemia. Assess your diet. Are you eating enough protein, healthy fats, and complex carbohydrates? Poor nutrition can lead to low energy levels. Monitor your sleep quality. Even if you're getting 7 to 9 hours, frequent nighttime waking or sleep apnea can leave you feeling exhausted. Get a full medical checkup. A doctor can run blood tests, hormone tests, and imaging scans to rule out serious conditions like cancer, diabetes, or heart disease. Final warning: don't dismiss this sign. Many seniors make the critical mistake of assuming that persistent fatigue is just part of aging. They ignore the warning signs until it's too late, allowing serious illnesses to progress unchecked. But the truth is, aging itself does not cause extreme fatigue. Something else is happening inside your body. If you or a loved one has been feeling constantly exhausted for weeks or months, don't wait. Seek medical advice as soon as possible. Early detection could be the key to saving your life. Sign number 3. Unexplained weight loss. A silent red flag that could mean cancer for many seniors. Weight naturally fluctuates over time. Some days your appetite is bigger, other days you eat a little less. But what happens when you step on the scale and realize that, week after week, your weight is steadily dropping, even though you haven't changed anything about your diet or exercise? At first, losing weight might not seem like a bad thing. Some people even welcome it, believing it's simply part of aging or a result of eating a little less than before. But unintentional weight loss is one of the earliest and most ignored warning signs of cancer, one that too many seniors fail to recognize before it's too late. The reason this is so dangerous is that, unlike other signs of illness, weight loss often doesn't come with immediate pain or discomfort. It's subtle, gradual, and easy to dismiss. But when your body is shedding pounds for no reason, it could mean that something far more serious is happening beneath the surface. Why does cancer cause weight loss? Cancer can hijack your body's resources, making it burn through fat and muscle at an accelerated rate. It can suppress your appetite, interfere with digestion, or even change the way your body processes nutrients. Some cancers increase metabolism, forcing your body to burn calories much faster than normal. The worst part? These changes happen without you realizing it. You might not feel sick, but your body is working overtime to fight something hidden within. Doctors generally consider losing more than 5% of your body weight over 6 months without trying a serious cause for concern. That means if you weigh 160 pounds and lose 8 pounds without effort, or if you're 200 pounds and drop 10 pounds with no explanation, it's time to pay attention. Many seniors think that weight loss is just a part of aging, but when it happens suddenly and without reason, it could be a sign of an underlying health issue, possibly cancer. What types of cancer are linked to sudden weight loss? Several types of cancer are particularly known for causing weight loss, often before other symptoms appear. Pancreatic cancer, one of the deadliest cancers, it disrupts digestion and metabolism, making the body lose weight rapidly. Many people don't notice symptoms until it has already progressed to an advanced stage. Lung cancer. This type of cancer can cause inflammation and increased metabolic rate, making the body burn more calories than usual. Even if you're eating normally, you might still lose weight. Stomach cancer. Early symptoms of stomach cancer can include bloating, difficulty eating, and a decreased appetite, all leading to steady weight loss. Colon cancer. This cancer can lead to malabsorption, meaning your body doesn't absorb the nutrients from your food as it should. Esophageal cancer. If you find swallowing becoming more difficult, leading to a reduced food intake, it could be a sign of something serious. Many people assume they are losing weight simply because they're eating less or because they've been more active than usual. But if the weight keeps dropping and you can't explain why, it's a red flag that should never be ignored. Other symptoms that may accompany weight loss. Unexplained weight loss often doesn't come alone. Many people also experience fatigue, feeling more tired than usual, even after a full night's sleep. Loss of appetite, not feeling hungry, even when you know you should eat. Digestive problems, bloating, nausea, or changes in bowel habits. Weakness, noticing that daily tasks feel more difficult than before. How to monitor your weight and know when to take action. If you're over 60, it's important to weigh yourself regularly, at least once a week. If you notice a consistent downward trend over time and can't explain why, don't wait. Keep a record of your weight and any additional symptoms you might experience. Here's what you should do if you notice unexplained weight loss. Document your symptoms. Keep track of how much weight you're losing and any additional changes you experience, like fatigue, changes in appetite, or digestive issues. Consult your doctor. If you've lost more than 5% of your body weight in a short period, it's time to get a medical evaluation. Blood tests, imaging scans, or other exams might be necessary to rule out serious conditions. Don't ignore it. Many seniors dismiss early symptoms, thinking it's just part of aging. But catching problems early can save your life. The importance of early detection. The biggest mistake people make is waiting too long to address these warning signs. Cancer is most treatable in its early stages, but once it spreads, options become limited. Unexplained weight loss is never normal, especially as you get older. The sooner you take action, the better your chances of identifying the issue before it progresses. If you or a loved one has been experiencing weight loss without a clear cause, don't ignore it. Listen to your body and speak with a healthcare professional as soon as possible. Your health is too important to leave to chance. Sign number 4, chronic fatigue. When tiredness becomes a silent warning as we age, it's natural to feel a little more tired than we did in our younger years. You might wake up feeling groggy, need a nap in the afternoon, or go to bed earlier than you used to. That's all normal. But when exhaustion becomes a constant, overwhelming, and unexplainable presence in your life, no matter how much rest you get, it could be a warning sign that something deeper is going on. Chronic fatigue is one of the most overlooked early signs of cancer among seniors. Too often, people dismiss it as just a normal part of aging, thinking it's because of their busy schedule, lack of exercise, or even stress. But when fatigue becomes persistent, making daily activities feel exhausting, it's time to pay attention. Why does cancer cause fatigue? Cancer-related fatigue is very different from normal tiredness. It's not just about feeling a little sluggish or needing an extra cup of coffee in the morning. This kind of fatigue doesn't go away with rest and often worsens over time. It can feel like a deep, body-wide exhaustion that makes even simple tasks, like walking, cooking, or getting dressed, feel like a struggle. This happens because cancer affects the body in multiple ways. Cancer cells hijack your body's energy. Tumors consume nutrients at a rapid rate, stealing them from your muscles and tissues. Your body works overtime to keep up, leaving you feeling drained. Inflammation increases. Many cancers trigger inflammation in the body, which can interfere with normal energy production. This can cause muscle weakness, slow recovery from exertion, and persistent tiredness. anemia develops. Some cancers, especially leukemia and lymphoma, affect blood cell production, leading to anemia. When your red blood cell count drops, your body doesn't get enough oxygen, making you feel weak and dizzy. Sleep disturbances occur. Even if you feel exhausted, you might struggle to sleep well at night. Cancer can interfere with sleep cycles, causing night sweats, discomfort, or even pain that keeps you awake. How is cancer-related fatigue different from normal fatigue? Everyone feels tired sometimes, but the key difference is how long the fatigue lasts and how severe it is. Here are some warning signs that your exhaustion might be linked to something more serious. You feel extremely tired every day, no matter how much you rest. You wake up exhausted, even after a full night's sleep. Simple activities, like showering or walking to the kitchen, feel exhausting. You experience dizziness, weakness, or an overall sense of heaviness. You don't have the energy for hobbies, conversations, or socializing. If your fatigue has been ongoing for weeks or months, getting worse instead of better, and interfering with your ability to function, it's not normal tiredness. It's a sign that something is wrong. What types of cancer are linked to chronic fatigue? Cancer-related fatigue can happen with many different types of cancer, but it's especially common with leukemia and lymphoma. These blood cancers directly affect your red blood cells, causing anemia and extreme fatigue. Colon cancer, internal bleeding from tumors, can cause iron deficiency, leading to severe tiredness. Lung cancer, the body has to work harder to get oxygen, which can leave you feeling weak and breathless. Ovarian cancer, this cancer is known for causing persistent, unexplained fatigue in women. Pancreatic cancer, it can interfere with digestion, making it harder for the body to absorb energy from food. Even cancers that don't directly affect the blood or digestion can cause fatigue by triggering inflammation, draining your energy reserves, and forcing your immune system to work harder than usual. Other symptoms that may accompany chronic fatigue. Fatigue alone isn't necessarily a sign of cancer, but when it appears alongside other symptoms, it becomes much more concerning. Look for signs like unexplained weight loss. Losing weight without trying is often a sign of underlying illness. Persistent pain, aches, soreness, or discomfort that doesn't go away could indicate an internal issue. Frequent infections. If you're getting sick more often or taking longer to recover, your immune system may be compromised. Changes in appetite, eating less, feeling full quickly, or experiencing nausea could be related to cancer. What should you do if you're experiencing chronic fatigue? If your fatigue doesn't go away and is interfering with your daily life, don't assume it's just part of aging. Take these steps to get to the root of the problem. Keep a fatigue diary. Write down how often you feel exhausted, how long it lasts, and what activities make it worse. Check for other symptoms. Pay attention to weight changes, appetite loss, night sweats, or pain. Talk to your doctor. A medical professional can run blood tests, check for anemia, and look for signs of underlying conditions. Get screened for cancer. If fatigue is unexplained and persistent, a full health evaluation, including imaging and lab work, might be necessary. The importance of early detection. One of the biggest mistakes seniors make is assuming that feeling tired is just a normal part of aging. While it's true that energy levels change over time, crippling exhaustion that lasts for weeks or months is not normal. If cancer is the cause, catching it early could save your life. Ignoring fatigue could mean allowing a hidden illness to progress to a more advanced stage. The sooner you address it, the better your chances of stopping it before it spreads. If you or a loved one has been struggling with constant, unexplained fatigue, don't wait. See a doctor, get the tests you need, and take control of your health. Sign number 5. Unexplained pain that won't go away. A silent warning. Pain is one of the most common experiences in life, and as we get older, it becomes even more frequent. Aches in the joints, stiffness in the back, sore muscles after a long day. These are things most seniors have come to accept as part of aging. But what if a pain lingers longer than it should? What if it starts to grow worse instead of better? What if it appears without any clear cause, and no matter what you do, rest, medication, or therapy, it simply refuses to fade? Unexplained, persistent pain is one of the most ignored signs of cancer, especially in older adults. Many people assume that pain is just a natural part of growing older, something to be endured rather than investigated. They might take a painkiller, apply some heat or ice, or try to push through the discomfort, believing that it will eventually subside. But when pain doesn't go away, when it settles deep into your body and becomes a constant presence in your daily life, it's time to pay attention. Cancer-related pain can manifest in many different ways, and it's not always the sharp, sudden pain that people associate with injuries. Instead, it can be a dull ache, a deep burning sensation, or even an uncomfortable pressure in certain areas of the body. It can start in a single spot and gradually spread, or it can feel like a generalized soreness that makes movement difficult. Unlike normal aches and pains that come and go, cancer-related pain persists, often growing worse over time. What makes this pain particularly dangerous is how easily it can be dismissed. Someone experiencing back pain might blame it on an old injury or poor posture. A persistent headache might be attributed to stress or dehydration. Stomach pain might be written off as indigestion or acid reflux. While all of these explanations can sometimes be correct, there comes a point when ignoring the pain becomes a risk. Pain from cancer doesn't always behave like normal pain. It doesn't necessarily get better with rest. It doesn't always respond to typical treatments. It can strike at odd times, waking you up in the middle of the night, making daily tasks unbearable, or appearing without any clear reason. Even more concerning, it can be a sign that cancer has been silently growing in the body for months or even years, spreading beyond its original location and affecting nerves, organs, and tissues. For instance, persistent bone pain could be a sign of leukemia or bone cancer, where abnormal cells are growing within the marrow and weakening the structure of the bones. A deep, unrelenting pain in the abdomen could point to pancreatic cancer, which often remains hidden until it reaches an advanced stage. Chronic back pain, particularly if it doesn't improve with movement or changes in position, could be a sign of spinal tumors or metastasized cancer from another part of the body. Another reason why pain should never be ignored is that it can indicate nerve involvement. Cancers that press against or invade nerves can cause neuropathic pain, a type of discomfort that feels like burning, tingling, or electric shocks. This pain can radiate from the site of the tumor to other parts of the body, making it difficult to pinpoint the exact source. If you've been experiencing shooting pains, persistent numbness, or unexplained tingling sensations, it could be a sign that something is pressing against your nerves. But perhaps the most important thing to understand about cancer-related pain is that it's not always severe. Many people expect cancer pain to be unbearable from the start, but in reality, it can begin as nothing more than a mild, nagging discomfort, something that's easy to ignore or push aside. This is one of the reasons why cancer is often diagnosed too late. If the pain isn't extreme, people assume it's not serious. They wait, hoping it will pass. But over time, it slowly worsens, growing more intense and more frequent until it becomes impossible to ignore. And by then, the cancer may have already progressed to an advanced stage. Ignoring persistent pain is one of the biggest mistakes a person can make when it comes to their health. If you have pain that lasts for weeks or months without a clear cause, it's crucial to seek medical attention. Even if it turns out to be something minor, getting checked early is always better than waiting too long. Your body is constantly communicating with you, sending signals when something is wrong. Pain is one of its most important warning systems. If that warning system is going off day after day, don't silence it with painkillers and wishful thinking. Listen to it. Because catching cancer early, when the first warning signs appear, can make all the difference. Sign 6. Unexplained weight loss. As we age, maintaining a healthy weight becomes increasingly important, as it plays a significant role in our overall well-being. However, when weight loss occurs unexpectedly and without any obvious reason, it can signal a serious health concern. For seniors, unexplained weight loss can be one of the earliest indicators of cancer, and yet many overlook this symptom until it becomes too late. In this segment, we will delve into the reasons why seniors should pay close attention to weight changes and the potential risks associated with losing weight unexpectedly. First, it is essential to understand that weight loss isn't just a cosmetic concern. It is often a reflection of something happening inside the body. For many individuals, weight loss occurs due to changes in their eating habits or a reduction in physical activity. But when weight loss happens without any changes in lifestyle, it may indicate a more serious issue. For seniors, the reasons for unexplained weight loss can range from hormonal imbalances to chronic illnesses, and one of the most concerning possibilities is cancer. Cancer can cause weight loss in several ways. The body's immune system, when fighting cancer, often becomes overwhelmed, and energy is directed toward combating the disease. This can result in a decrease in appetite, which leads to weight loss. Additionally, some cancers, especially those that affect the digestive system, can make it difficult for the body to absorb nutrients properly, further contributing to weight loss. In cases of advanced cancer, the body may also experience muscle wasting, which can contribute to the loss of lean body mass and overall weight. For seniors, any unexplained weight loss should not be dismissed as a normal part of aging. While it is true that metabolism naturally slows down with age, and weight fluctuations may occur, a sudden and significant weight loss can be a warning sign of a serious underlying health condition. Cancer is often one of the primary culprits, particularly in its early stages when symptoms may be subtle. The sooner a potential diagnosis is made, the more likely it is that the condition can be managed or treated successfully. One of the challenges with unexplained weight loss in seniors is that it may not always be noticeable right away. As people age, their metabolism naturally slows down, and their appetite may decrease, so small fluctuations in weight might be attributed to the natural aging process. However, if the weight loss becomes noticeable over time, it is crucial to take action and consult with a healthcare professional. Even a modest amount of weight loss, especially if it is more than 5 to 10% of an individual's body weight, can be significant and should not be ignored. Moreover, unexplained weight loss can sometimes be accompanied by other subtle signs that are easy to overlook, such as a loss of energy, weakness, or difficulty eating. When these symptoms appear in combination with weight loss, it may indicate that the body is struggling with an underlying issue. Seniors may not always recognize these changes as something to be concerned about, but it is important to consider the broader context of these symptoms, especially when they persist over time. The types of cancer that most commonly lead to unexplained weight loss include cancers of the digestive system, such as colorectal cancer, pancreatic cancer, and stomach cancer. These cancers can interfere with the body's ability to process food, absorb nutrients, and maintain a healthy weight. Other cancers, such as those affecting the lungs, liver, or kidneys, can cause changes in metabolism that lead to unintended weight loss. While weight loss alone is not a definitive indicator of cancer, it is one of the red flags that should prompt seniors to seek medical attention. If there is any concern about unexplained weight loss, it is important to undergo a thorough medical evaluation. A healthcare professional can conduct various tests, including blood work and imaging, to determine the cause of the weight loss and rule out potential conditions like cancer. Catching the disease early increases the chances of effective treatment and improves outcomes. Seniors should also be aware that weight loss may be linked to other health conditions that may not be immediately obvious. For example, malnutrition or dehydration can also cause weight loss, and these conditions may arise from other health issues such as poor appetite, difficulty swallowing, or gastrointestinal disorders. In some cases, weight loss may be a side effect of medications, particularly if they affect appetite or digestion. For this reason, it is essential to discuss any changes in weight with a doctor, who can help determine whether it is related to an underlying health issue or a side effect of treatment. Maintaining a healthy weight is essential for overall health, and unexplained weight loss should not be ignored, especially as we age. If weight loss occurs without any apparent reason, it is essential to seek medical advice as soon as possible. Timely intervention can help prevent the development of serious conditions, such as cancer, and provide seniors with the best chance for recovery. As with many health issues, early detection is key, and seeking help early can make a significant difference in outcomes. In conclusion, Unexplained weight loss is one of the most common and important signs of cancer that seniors often ignore until it is too late. By paying attention to changes in weight, seniors can take proactive steps to protect their health and ensure they are not overlooking a potential problem. Early intervention and medical consultation are crucial in identifying and addressing the causes of weight loss, whether related to cancer or other underlying conditions. Seniors should trust their bodies and seek professional help whenever they notice significant or unexplained weight changes. This awareness and prompt action can go a long way in preserving both health and quality of life.